I will be focusing mostly on the biosensing technologies that we have developed and we are working towards implementing in the maternal health care. As Lauren said, I do work on a lot of different things, but this is a major focus of area for us as well. And I think this is an apt platform to talk about these technologies. Okay, so I will, before I start talking about the topic itself, I just wanted to take you through the journey, through my journey so far. So I was born and brought up in India. I did my bachelor's and master's in engineering degree there. So I'm a biomedical engineer by training. And following that, I won the Marie Curie Fellowship to pursue my PhD under a very unorthodox graduate study program, I would say. I was doing my research under a consortium, which was like a group of different universities coming together to pursue a research idea. And I was, the consortium included 2 EU universities as well as one European Union associated university. And during this time, I got the opportunity to explore European culture as well as learn from different perspectives, as I had 3 PIs as opposed to 1 or 2 PIs that usually a PhD program have, right? So after finishing my PhD, I joined McMaster University in the east of Canada, Hamilton, where I did my postdoc. And then 2 years ago, I joined University of Calgary as an assistant professor in the newly formed Department of Biomedical Engineering. And here I'm leading the Wearable and Biointegrated Technologies Lab, where we develop a lot of different things, but one of the focus is developing or basically integrating these biomolecular assays onto point of care or wearable devices. So we'll focus on these 2 technologies for sure today, and we'll see how these are being used in maternal health applications. So before I talk about what we do in the lab, I just wanted to give a brief introduction to biosensors so that everybody is on the same level about what we are working, right? So we all know what a sensor is. It's a device that can sense or measure a change in a physical quantity. So for example, if it is a change in temperature, then it's a temperature sensor. And an biomedical example is a thermometer. In the same way, if a sensor can detect a biomolecule in a sample, then it is called a biosensor. So a sample could be anything. It is a matrix, basically, which where we want to detect something, a biomolecule. And it could be a cell or tissue culture. It could be food sample. It could be environmental sample, or even human samples, blood, saliva, urine, all those things. Now, there are 2 main components in a biosensor. There is a transducer and an electronic system. So transducer is something which is responsible for measuring this change in physical quantity. And electronic system analyzes that change and displays it for the user. Now, on the transducer side, we also have a very important piece called bioreceptor, and this is what basically I engineer or develop. Bioreceptor is, again, any biomolecule that is integrated onto the device, and its function is very straightforward. It interacts with the target biomolecule in the sample, and it produces a change. So it's pretty much like a yin-yang combination. So if you have antigen to be detected in a biosample, then you would use an antibody because that's like complementary to the antigen. And if you have a DNA there in the biosample that you want to detect, you will use a complementary sequence as well on the bioreceptor side. So it's like a yin yang. I always explain it in that way. So this is what constitutes a biosensor. Now, what are some of the advantages of having a biosensor? It's basically very specific because we have a specific bioreceptor that has the ability to interact with the target analyte in the sample. So the functionality of bioreceptor makes it highly specific for whatever we want to detect in a sample. It's also sensitive, meaning it can detect the lowest concentration in a biological sample. And that is attributed to the transducer unit. And I cannot emphasize enough, these are the two most important components that we develop or engineer to be as efficient as possible in a sensor. And then the other advantage is that these can be miniaturized with the added benefit that it can be integrated with all the reagents that you would need for a molecular diagnostic test. And this is done because you don't want to carry these devices if you have a use case in a remote location or a location where the health infrastructure is not that good, and you want to apply it in a point of need situation, right? So, and because you want to apply it in a point of need situation, we also try to make the response time as quick as possible. And these are some of the consideration and advantages we try to incorporate into these biosensing devices. Some of the examples, if I can give you, are the glucose monitors, the blood glucose monitors that people with diabetes or pre-diabetic conditions they use at home. We also have the rapid diagnostic test. These have been used quite a lot when the COVID came, and they're still being used for screening purposes. And then we have these continuous or wearable sort of biosensors called biowearables, which also detect these biomolecules invasively or non-invasively, but you can wear them on your body, right? So these are some of the examples of biosensors. Now I'll give you some motivation on, or maybe I'll talk about the motivation I have to pursue or to use these devices for women on maternal health applications, right? So, so to do that, I wanted to pose this question to the audience. What, according to you, is an illness that puts women at greater risk of death? And you can give me an answer in the chat, or I can give you a couple of seconds to think about it. And if you don't want to type, it's totally okay. I can just discuss this from my point of view as well, right? So if you have an answer, please feel free to put something in the chat, and I'll give you a couple of minutes or seconds maybe. Yeah, so I'm getting some great answers in the chat. And some of the good answers are obesity, cardiac MIs, and cardiovascular diseases, stroke, gestational diabetes, agree, bone, breast cancer. Yeah, I'm happy to see that not a lot of, I see a lot of cardiovascular disease as the answer in the chat. I mean, I will talk about my personal view. For a very long time, I used to think breast cancer is a disease or an illness that will put me at greater risk of death. And it's an important disease that happens to us as women, right? And many women like me, when asked what illness puts them at greater risk of death, they will usually identify breast cancer without even realizing that cardiovascular disease carries greater risk in of death, right? And this has implications for promotion of health efforts. And for many years, as a scientist or as a biomedical engineer, I would say that we have thought that the reproductive health was the only difference between men and women. And we now know that that fact is not true. And for a variety of reasons, women's health has suffered for it because a lot of the critical health decisions were made in dark. And all the existing tools that are there in the clinical area that are used for assessing women's health, they were not intentionally designed to meet the needs of the complex biology or the emerging models that we have. So for me, the underlying message that I'm trying to give here, or the underlying message that has hit hard for me personally, is that the women health is severely underlooked when it comes to developing or engineering biomedical devices. And my focus is more on developing devices that can be more inclusive and aware of this fact, right? And when we talk about the unmet need of outpatient maternal health space, then we are adding another layer of intersectionality to it, to the whole problem. And if I can just give you a small statistic data, I was just reading through some of the papers, and I found out that in 2020, a woman was still dying every 2 minutes due to pregnancy or childbirth. And the things have improved since then in the last 4 years, but still an estimated of 2.8 million pregnant women and newborns still die every year. And mostly because of the preventable or treatable causes. And we all know that, the healthy mothers, if you want healthy babies, you got to have healthy mothers. And a lot of the care has been taken into providing the antenatal care from the beginning of the pregnancy until the onset of labor, to ensure that the mothers are healthy and then the babies are healthy. And some of the antenatal care includes, the recording medical histories, providing guidance on pregnancy and delivery and all these things. But one of the major area of this care is also screening tests and health monitoring and identifying conditions that are detrimental to health during pregnancy. And this is a major focus of area for me because I want to develop these devices that can provide an ease to the mothers and the clinicians or the healthcare providers, so that they can obtain these useful information in time and avoid any complications in the pregnancy. Okay, so what already exists in this area? So the healthcare market for women diagnostics is basically divided into these 8 segments. Breast cancer is one of the largest market because of the awareness and a lot of different things. But I am very happy to see that the future looks very bright. Like there are a lot of like-minded people who are working towards developing these medical diagnostic devices or health monitoring devices for problems that are related to women and women who are pregnant as well. So for example, I am taking examples of some of the companies here. So for example, June Bio from UK, they have been developing this at-home vaginal microbiome test to detect the disruption of microbiome. We have homegrown company Fibra Inc., as well as some companies in Switzerland, for example, Eva Women, who are working towards developing wearable fertility trackers. And then we also have some companies like Biohealth that is monitoring the reproductive cycle using wearables. So there are a lot of companies that are coming up in this area, and we are about to see a 50% increase in the market share as well in this area. So it's a very upcoming market as well. Okay, so now that I think I've given you some motivation and understanding of what I'm doing and why I'm doing it, I want to focus more on introducing now some of the technologies that we have developed in our lab. And mostly these will be the biowearable and point of care technologies. And really all the work has been done by my students. Some of the pictures that you can see here, with the support of the amazing collaborators and the funding. So I just wanted to acknowledge that them in the beginning itself. Okay, so the first technology that I want to talk about is a biowearable technology that we have been working to develop. And this is catering towards understanding the perinatal mental health indicators. So perinatal mental health health is basically the mental health of women during pregnancy and 1 year after the delivery during postpartum. And the context behind me doing this project is a bit personal, because I have a friend who was diagnosed with this, and for a very long time, she did not know that she had this condition. And when I was writing my first grant in this position, I was very keen on doing something about this. And so I reached out to some of my colleagues in the nursing faculty, and they gave me a lot of understanding about this area. So I was told that globally this is a very important problem and one of the leading causes of disability in women, at specifically in the perinatal stage. And in Canada itself, a lot of the cases of these conditions are not explored. And if a woman goes as an onus, taking an onus on them, and then goes and talk about this, then only a few of them gets the treatment since the birth of their child and this is a data from 2019. So when I was talking with them, they told me that there are many different indicators. It's not just one thing that you can detect in pregnant women's body that will tell you concretely that this is happening. And then I was thinking, because there are many different indicators, we need to have a technology that can pick up these different indicators and make sense of it. Now, to make sense of it, you are basically generating a lot of data, and you need to try and make sense of that data. So I reached out to my colleague, Dr. Aditya Nitala in the computer science department. He plays with data and try to make sense of those data. And then we formed a team, and then we wrote this grant, we got this grant, and we started working on making a biowearable where we are able to understand the interplay between the blood cortisol, the sweat rate, and the heart rate variability, and see if it connects with understanding the perinatal mental health of a woman. So yeah, so again, the patch that we are trying to develop is a textile patch that has all these different sensors, and it can sort of detect these three, biosignals from a women's body. Okay, so we started with the cortisol. We tried to do a non-invasive sweat cortisol level detection. And we created this fully integrated device. It has, let me see if I can. Yeah, so it has this sensor connected with the electronics, and you can make it in the form of a watch. And the way it works is that it has a bioreceptor, we call it aptamer. It interacts with the cortisol in sweat and then gives you a signal. It's an electrical signal, and then we then convert that into the concentration of cortisol in sweat. We started with a patch that you can, it's like a tattoo patch that you can attach. Then we moved on to making, a watch-like form factor for this biowearable. And then when we connected with the application on the mobile phone, we were able to see the differentiation between the signal of if there is no cortisol present or if there is a cortisol present. So now, currently, what we are trying to do with this sensing device is to validate it with the healthy participants to create a baseline. And then following that, we want to move on towards testing this with women who have been diagnosed with the condition. The next thing that we are doing, because in the grant we propose a textile patch. Now that we know how the cortisol detection works, and we have been seeing some good results out of it, we are trying to now fabricate textile patches that can be integrated, and it's removable textile patch, so you can connect it to a piece of clothing and then remove it again. And so you don't have to wear it all the time. You can just wear it during the day, and while sleeping, you can remove. And then with these textile patch, again, we are trying to integrate different types of biosignal monitoring. So we are trying to look into the sweat bioanalyte monitoring, as well as the sweat rate or the conductance monitoring as well. And the first step to do that was to find out what sort of textile can be made into a biosensor. So we worked with some of the commercially available textiles, and we tried to integrate it with the bioreceptor, and it works with an analyte and gives a signal that you can see over here. Now, again, this is done in collaboration with our colleagues in the electrical engineering department, Dr. Leung, who is developing the communication device, because the previous version was it was wired, but then this one we wanted to make it completely wireless, that can be worn by a woman whenever and wherever they want. Yeah, so what's next in this area for us? We are looking into developing different kinds of form factors for these devices. So we are looking into smart jewelry. We are looking into smart clothing, and also trying to understand what kind of form factor women would like to wear. And this is an important point, because we found through a survey that not everybody likes to wear smart watches. Some people do not at all wear smart watches. So we don't want to push them to wear it. So we are trying to understand what would be the best form factor to be developed into a biowearable. And then on the application side, we are also looking into understanding the indicators of migraine. A colleague has brought this problem to us, and then we think the skin conductance and glucose level can be monitored to understand the onset of migraine. Gestational diabetes, again, this is specific to women, but then any sort of continuously monitoring devices for glucose can be used for this. We are trying to, again, understand if we can integrate into a textile and then see if that can be used for understanding this condition. And then the fertility monitoring, we're trying to also look into markers or the biosignals that we can exploit to measure or to monitor the fertility in women. Okay, so the next type of technology that I want to talk about is a point of care technology that we developed some time back. And it was for the urinary tract infection, which is one of the frequent type of infection during pregnancy. And, every woman has to go through a screening for UTI during pregnancy, and subsequently they're treated with the antibiotic therapy. And the maternal UTI is also associated with preterm delivery, low birth weight, and many other different complications, right? So it became more important for women who were at the outpatient healthcare setting, because there, if we talk about the logistic of collecting the sample, taking it to a central lab, and doing all the testing, so which is usually done by microscopes or urine pH paper, or the staining and understanding what kind of microbes are there causing this. So we wanted to avoid that long period of time that women has to wait before they are given any sort of treatment. And to do that, we developed a test which was rapid. So it took us less than 1 hour to conduct from sample in to answer out this test. It was culture free, so all you needed to do was to take the urine sample and run it through a device. And it was completely reagent free because all the reagents were integrated onto the device. So this was very much like the glucose monitoring device that you use, pricking your finger and then putting your blood. Instead of putting the blood, we took the urine samples and then put it through a series of devices that could do some sample pre-processing, and then put it on these test strips that will connect to a reader and display the outcome. And again, the way it works is that it uses a very specific bioreceptor for specific bacteria called E. coli, which causes the UTI, and tells you how much E. coli you have in your urine without even having to do long culture of that bacteria. So this was done in 2021. And now and we were able to achieve really good results. We tested with some patient samples, and we were able to achieve 100% sensitivity and 85% sensitivity. But the problem was that it was too sensitive. And because of that, we were even getting signals for the non-specific bacteria, right? So because of that, we moved into separating the biorecognition, so the interaction with the bioreceptor and the E. coli, and the signal generation, so the transducer part. And when we did that, we were able to get or improve the specificity to 95%. And currently, this test just test, detect E. coli in urine. So we're also looking into finding ways of multiplexing it for multiple bacteria targets so that we can, expand the scope of this test for many different bacteria that causes UTI. Okay, so what's next? Again, in point of care field for us, we are trying to also look into preeclampsia biomarkers and develop that into a point of care lateral flow assay. So this is again done in collaboration with Dr. Keegan Kim from Mechanical Engineering Department. And we have a PhD student, Philippa, who has brought this idea to us. And she's working on integrating 3 different biomarkers in collaboration with some clinicians here. And we are trying to see if we can improve the efficiency of existing lateral flow tests because they already exist. Some of them uses the PLGF as the biomarker. Some of them uses the ratio of SFLT1 and PLGF as well. And then the idea again would be to basically take these tests, put the blood sample and then measure the 3 different biomarkers that could have implications of preeclampsia in women. And again, aiding it with early diagnosis would be the ultimate goal for this project. The other project that we have just initiated talks with another clinical professor at Foothills is on the cervical cancer. It will again be a lateral flow device that would detect the HPV. And we will have to definitely do the non-invasive collection of the virus and then do some pre-processing, but then at the end the detection would be converted into a 15-minute test as opposed to the longer time duration test that is currently done for this virus. Yeah, so I think this is it. These are some of the technologies that we have developed. And this brings me to the conclusion. And this is a very atypical slide where I know I should be waiting to answer some of your questions, but I will be leaving you with many of the questions that I have been asking my students and my group and my collaborators as well. Because I think unless we don't ask right questions, I think a lot of these problems will not be solved. So I wanted to start with asking this first question to probably the audience who is into clinical research. What are other clinical problems you think that can be solved in this area using biosensors, right? So this is one of the questions that I would ask in my conclusion to the people who are working on clinical research. On the other side, I know there are a few biomedical engineers or engineers who are working into developing biomedical devices. And to them, I would like to ask, can we bring these biosensors on par with existing technologies? So for example, RDTs came in, but then they are just screening tools. They are not on par with the PCR, right? So, and this is a question that we try to investigate in our research as well, because we want to improve the sensitivity, improve the specificity, so that it can, not just aid the current technology, but also becomes one of the mainstream technologies in this field. And the third question is basically to both the clinical research and engineering audience, where I would like to ask you that, or maybe invite you to, have a discussion with me about can we bridge the gap between the women's health and biosensing technology, and how can we do that? So I think I leave you with these three questions with, very underlying message that I really think there is immense potential of biosensors that is untapped and can be utilized in women and maternal health applications. Yeah, okay. So I think this is it from my side, and I think I'm 5 minutes early, so we have enough time left for people to ask questions. Yeah.
All right. Thank you so much, Dr. Pandey. That was absolutely fantastic. And so for everybody in the audience, feel free to either come off of mute and ask a question, pop it into the chat, or we also have a question and answer box if you're feeling shy today. I'm going to stop recording.